The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Handouts are also available, and they are in the handout section. Now, before we get started, I'd like to introduce our speaker. Dr. Artie Nair is a postdoctoral fellow with the UCLA Amundsen Lovelace Brain Mapping Center and the UCLA Pierce Clinic at the Semel Institute for Neuroscience and Human Behavior. Her primary research interests lie in multimodal imaging studies of social cognition in ASD. She is also a clinical neuropsychology fellow in the Medical Psychology Assessment Center. You can type your questions into the questions section starting now and throughout the talk. She'll answer as many as she can at the end. These webinars are made possible through donor support, including a generous grant from the local 25 Boston Teamsters. If you'd like to contribute, please visit our website at autism.com. And now I'll turn it over to Dr. Nair.
Thank you, Denise. So today I'll be talking about the science of making friends, which is our UCLA Peers program. I'm going to go over so today I'm going to talk about the science of making friends, which is our UCLA Peers program. And I'm going to just go over the background that went into the development of the program, a brief overview of the curriculum, and then talk more about the research that supports that this is an evidence-based social skills intervention. So just to begin with, the kind of social deficits that we are trying to target with amongst youth with autism spectrum disorders primarily through this program are poor social communication. So we find often in this population that there are teens and young adults face a lot of problems with even initiating topics of conversation, knowing what kind of topics their peers might be interested in, moving away from repetitive themes or a tendency to perseverate on their own sort of restricted interests. These teens are often, or their caregivers are often complaining about one-sided conversations, right? So especially if it's not a topic that they're highly interested in, conversations tend to be one-sided, either they are talking too much about their own topic or they're not responding enough to the other person's topic. So what ends up happening is a failure to identify common interests with their peers, which is one of the key factors that helps us connect with peers and make friends. Other things that they struggle with might be, providing relevant information about themselves or making unexpected leaps in topics. And then there's there's the sort of the nonverbal factors that go into these poor social communication skills as well, such as, tone of voice, maybe using a very pedantic, professorial style of speaking, poor tone of voice, the kind of the musical quality of our voice, which is called prosody. They struggle a lot with that, as well as difficulty with interpreting verbal and nonverbal social cues. So other people's tone of voice, use of sarcasm, gestures, or even things like social touch. So that's one piece we want to target. Another piece that we want to address is poor social awareness. So even just kind of, using appropriate eye contact to monitor what's happening in your social environment. So often our teens and young adults are missing out on a lot of social cues in their landscape. And part of that might be they're not always kind of really socially watching what's happening around them. So that leads to poor social awareness on their part. Then we have poor social motivation itself. So, there's sort of this idea that, maybe people on the spectrum are not as motivated to make friends. But when we talk to our teens and young adults, they are actually interested in making friends. What tends to happen in that age group, it seems like, is, they've tried maybe several times or they've had some poor experiences in the past. And so, it's a combination of anxiety and not knowing what to do and past experiences, maybe that hold them back from being as socially involved as their peers. So we find that they are less involved in social activities like extracurriculars, sports, any teams or club, like group activities. And then, so then they don't have as much of an access to a social group itself. So there's fewer peer entry attempts made and fewer initiations made on their end. And then finally, we also want to target social cognition, which is the basic understanding of the social world. So one of the key things that we want them to develop well is their understanding of other people's perspectives. So we call that theory of mind, which is known to be kind of not as well developed, especially for people on the spectrum. And so, just putting yourself in the other person's shoe and being able to understand their point of view. And, also being able to empathize with that, right? So we find that our teens on the spectrum have a lot of emotional empathy. They get that, someone might be feeling whatever it is they're feeling, but being able to communicate that empathy is where they struggle. So that's another aspect we are trying to address through our program. And why are we trying to address these social areas is because there are some heavy social or consequences of these social deficits in our youth. So a lot of them tend to be socially neglected or isolated, they're not being invited to things. They're kind of perceived maybe as shy or kind of the loner by their peers. So they're mostly just kind of going unnoticed and not really not really initiating or being pulled into social engagements by their peers. Then there's a fair share of our teens and young adults that are actually rejected by their peers. So they're actually being targeted for some mean behaviors like teasing and bullying, and some of that might come from things they do that kind of stand out as being different, and then other times it might have been past unsuccessful attempts to socially engage others. So maybe things like using poor humor that they think is funny, but their peers might not think is funny, and then they kind of get stuck with these bad reputations because of that and get rejected by their peers. There's also, some level of peer conflict. So we find that, arguments are hard. I mean, it's hard for anyone to really resolve arguments, but especially when you have poor social skills, that's a very challenging kind of thing to handle. And so, often a minor argument may result in the termination of a friendship, which, especially when they have very few friendships, we want them to be able to hold on to those friendships. And, overall, there is generally a lot of data to suggest that there is a lack of close, meaningful, kind of deep, reciprocal friendships in our youth. So, the friendship quality overall itself is not that great. They might have some people they hang out with every now and then, but it's not the kind of deep, meaningful friendship that most of us and most of them crave and want. So other consequences of having poor quality of friendships is that there's just overall less companionship. They're not hanging out as much on the weekends or after school with their friends. They get less support from their friends and less help from friends. And there is less security within friendships, especially we see that more in like the teenage, young adult years, like at some point their peers, maybe they outgrow them in terms of emotional maturity and just kind of life interests and life goals. So there's a lot of insecurity there with existing friendships, which results then in a high sense of loneliness in our teens. And we found from research that, just having one or two close friends predicts really good, has really good protective factors. So for one, it predicts later adjustment in life and can protect us from the impact of a lot of stressful life events. So just having one or two close friends has been found in all these research studies to correlate positively with a person's sense of self-esteem as well as independence, and it correlates negatively with depression and anxiety. So those are some pretty interesting protective factors that friendships have for us. So now moving on to, what are the kind of social skills training out there and how we develop the Peers program to address these problem areas, right? So most of the existing social skills trainings don't actually include the teens or young adults themselves in the treatment. So they might actually just be targeting caregivers, as well, or parents usually are the ones who are involved in these treatments. Another thing is they don't necessarily teach ecologically valid social skills, right? So they might be taught skills that we all kind of generally basically know, but the teen world and sort of young adult social worlds are very complex in their dynamics, and so a lot of those don't translate to their actual world and interaction with their peers. They might be better suited for socializing with adults, for example, but not so much just within peers or peer groups. They also fail to take in both strengths as well as weaknesses into the teaching methods. So for example, one of the strengths could be that kids on the spectrum, a lot of them are rule bound. They like rules, they like predictability, they like having steps that they can follow, and a lot of them tend to stick to it when it's given in that format. Right. So that's something we try to address through our program, is use those kind of strengths and make it kind of rule driven and step driven and have list of do's and don'ts that then makes it kind of a predictable set of steps they can follow in each situation. Okay. A lot of treatment programs do not include homework assignments. So when you think about it, you might be in treatment once a week, and then what are you doing for the rest of the time, right? So there's so many opportunities during the week to continue practicing your social skills, but especially if they aren't set up as structured homework assignments, it's going to be hard to follow through on that. And so then that translates to, our skills not necessarily generalizing to other settings. So things you're learning in the treatment group might not be generalizing to school or to friend circles or extracurriculars that are happening during the week. Other programs don't include caregivers in the treatment. So they might just focus on the youth themselves and not include other caregivers. So again, there's a lot lacking there, because providers, again, might see them once or twice a week, and then they are with their caregivers for the rest of the time. So it's really crucial to include caregivers in these treatment opportunities to help continue these practices during the week. And a lot of our programs don't actually assess treatment outcomes. So what's going to happen, in terms of are these approaches that they're taking, are they actually effective, post-treatment, in the long run? What is the data there? A lot of them don't really share that or assess that yet. So just a little bit of background about Peers. This is a program that was developed at UCLA in 2004. The adolescent program is our most popular program. It's been translated into many languages and being used in several different countries. And we have a treatment parent-based program as well as a school-based program for the adolescent age range. We also have a program for preschoolers here at UCLA, and then we have a program for young adults as well. So what are some of the key factors that go into the Peers program? So these are parent-assisted treatments where you have concurrent parent and teen sessions. So parents and teens are kind of learning the same skills, but parents are being trained as social coaches. So they're also getting training on how to coach their teens on these skills. So we found that it's most appropriate for socially motivated teens, right? So teens who kind of want to change their social skills, want to improve their social skills, are willing and motivated to participate in all the elements of the program. Because as many parents here of teens would know, if you ask a teen to do something that they don't want to do, it's really hard to get them to do it. So it's really helpful to have them to be socially motivated, and we get a fair share of those teens. So, they do want to change their social lives. So we address some of those social deficits that I mentioned earlier in terms of what we see commonly in autism spectrum disorders, and we focus on building better relational skills with their peers. So the manual itself is a 14-week curriculum. So it's a 90-minute weekly session for 14 weeks or so, which is close to about 4 months. And we have some evidence base, which I'll go into a little bit later, for teens in middle and high school with autism spectrum disorders, young adults with autism spectrum disorder, teens with ADHD, teens with fetal alcohol spectrum disorder, as well as teens with sort of mild intellectual disability. The school-based program is pretty similar in content, but these are meant to be facilitated by a teacher in the classroom. And this is a 16-week curriculum, so it's about 4 months. And there's about a 30 to 60-minute daily lesson plan, not a weekly lesson plan. So the focus is, again, on building better friendship skills, but also handling some peer rejection and peer conflict that's happening in the school setting. Okay, so there's no parent groups for this one, but there are a lot of comprehensive materials that the teachers can share with parents on a weekly basis. And there is evidence base for treatment in middle school and high school age kids on the spectrum. The young adult program is sort of our most recent program, and so that has been published in 2017, so it's now available for all providers. This is a caregiver-assisted program, so it could be parents who are the caregivers, it could be life coaches, it could be siblings, it could be partners. We get kind of a mix of who the caregiver in the situation is. So it's similar to the teen group in the sense of there is a concurrent social coaching and a young adult session, except for the makeup of that social coaching group is slightly different than the teen group. Again, this is appropriate for socially motivated adults, which usually doesn't tend to be an issue at all for our adults. Most of the adults we see are very motivated to improve their social skills and their relational skills. But the focus is pretty much the same, which is on social deficits in autism spectrum disorders. Some of the, I guess, the differences between the two programs is that the young adult program focuses a lot more on developing some dating skills as well. So there's a little less time spent on talking about teasing and bullying, because that happens less and less as they are becoming adults, but there is a greater interest and readiness for dating. So we have a few lessons dedicated to those skills. This is a 16-week curriculum. Again, it's 90 minutes per week, and we, we see them for about those 4 months. And there's some evidence base for these young adults using this program with autism spectrum disorders as well. And then we have this book, The Science of Making Friends, which is meant for parents. So it's a parent resource for parents who might be helping or coaching their children through various different social difficulties or social situations. So it's pretty much built on our treatment program. So it focuses on friendship skills, relational skills, handling peer rejection and conflict, and there's some social coaching tips and things provided there. There's also some summaries available for teens and young adults that they can read through, kind of simplified language that's a good sort of reading material for them if they are interested in doing that as well, okay? And then we have, it comes with a DVD, so a lot of our role play videos are on that DVD. And then finally, right here, we have a friend maker app. It's a phone app that you can get through any kind of app store. I believe there's a slight difficulty right now for certain operating systems, and we're working on that. We're working on trying to fix that, but it's one that should be easily available to most people through their app stores to download, that has kind of a synopsis of all our different skills and role play videos. So the way we try to teach these social skills using evidence-based methods is through the use of small class formats. So it's about 10 to 14 students at most. That's kind of the amount of people we find to be, kind of a good size to do group practices with in the sessions, but also to be able to, for the provider or instructor to be able to provide enough individual attention to each student in the class. Okay. So we start out with some didactic lessons. So that's the actual, topic of the day, the lesson plan. We break it down into concrete rules and steps, as I mentioned earlier. And, the focus here is on making it ecologically valid, which means it's actually applicable in their everyday social life. Then we go into role play demonstration. So our team will model different social behaviors for them. So first they kind of do an inappropriate demonstration of the skill, which is usually sort of what are some of the common errors that people make when they do this, right? And so they watch that, and then we kind of do these perspective taking questions on it. That's where we try to enhance social cognition and social awareness, paying attention to social cues, body language, what the other person might have been thinking about in the situation. So exercising that theory of mind. And then we go into an appropriate role play demonstration. So the actual good social behaviors, the steps and rules that we want them to follow in that situation. And then we go through the same process. What was the reaction? What were the nonverbal reactions like? What were the people talking about to each other? And then perspective taking questions, like what is the other person thinking right now in this situation? Usually at the end of the groups, we have these behavior rehearsal exercises. So we break the group up into dyads or triads, or sometimes they work together as a whole group, depending on the lesson. But they basically practice all of the skills with each other while our providers are present to help coach them through that rehearsal. Every week there is homework assignment. So it's some kind of assignment where they're required to practice these skills in a natural social setting, like at school or with friends on the weekend or other social activities they might be involved in. And the target of those homework assignments is to help generalize the skills to their everyday life. And then we also, have kind of a similar format for the parent or teacher coaching, depending on if it's the parent program or the teacher program, so the school program. So what are the skills we're teaching them over the course of those weeks? So a lot of the emphasis initially is on conversational skills. So this is somewhere we find most of our teens say they struggle with this. So initiating conversations, what kind of information they should be sharing in their conversations, how to find common interests with people, having it be a reciprocal conversation. So it's just going back and forth equally and no one person is kind of dominating that conversation. And we also focus a lot on nonverbal communication. So, appropriate body boundaries, eye contact, importance of all of those factors in a conversation. We break these down by one-on-one conversations versus group conversations because the approaches are a bit different for each of those situations. We also talk a bit about electronic communication, so voicemails, emails, text messaging, social media, all of that. The rules are a little bit different about each one of them. So again, the approach is a little bit different. And so we make that, pretty concrete and step-bound for our teens. And we touch a little bit upon how to stay safe online because a lot of our teens are online right now. We also have a big focus in our program on actually choosing appropriate friends. So identifying what is the peer group or the crowd or the tribe that they are going to connect with the most, given their personality, given their interests. And this is something that would seem kind of intuitive, but it really isn't for our teens. So we kind of have to help them through that. And then the way to, once they identify the group, we have to help them kind of identify some extracurricular activities where they are likely to find these peer groups and have access to these peer groups. We also talk quite a bit about appropriate use of humor. So this is something we find our teens struggle with a lot. Some of them might just not be getting humor the same way the rest of us might be, but also often our teens are trying to use humor to connect with their peers, but they're not always paying attention to how their peers are perceiving their humor. So like the difference between people laughing with you versus people laughing at you. So we want to make sure that they're not being rejected by their peers because of their use of humor in any way. So we always talk to them about paying attention to their humor feedback, is what we call it. That is the reaction other people have to their humor. I already mentioned the peer entry strategies, as starting conversations, whether it's individual or group conversation. But we also prepare them with exit strategies, because you need to not only know how to enter and maintain, but also know how to leave the situation, right? So it's going to be different if it went well, and your exit is going to be different if it maybe was awkward or it didn't go well. So we kind of prepare them for all of those scenarios. We talk a little bit about good sportsmanship. Most of our teens, when they're hanging out with their friends, they might be playing some board games or, outdoor sports. Most of them tend to be doing video games. But either way, we want to make sure, they have good sportsmanship skills. They're not pushing their peers away by kind of being upset about losing or, kind of not being fair or cheating and things like that. So we talk to them about good sportsmanship skills, as well as how to actually plan and host get-togethers. So at their age, they should really be starting to become independent from their parents in setting up, inviting friends over for get-togethers, right? It's not an age where parents necessarily should be setting up play dates for them. So just what are the steps? How do you start? How do you invite people? How many times do you get to invite someone before kind of recognizing that they might be busy or not wanting to hang out? And then once you are actually hosting a get-together, what are some of just the hosting etiquette at those get-togethers? Other things we talk about are peer conflict and peer rejection situations. So like handling arguments with friends. We talk about what are some good conversation strategies to handle that, to resolve conflict with your friends and kind of move on from that while still saving your friendship. And then we talk about how to handle the various different peer rejection things that are generally happening more at school. So teasing, physical bullying, cyberbullying, even things like rumors and gossip, if they have a bad reputation at school or if they're constantly getting embarrassing feedback, for example, about hygiene or so, how to incorporate that into your life, but also how to handle that if that's happening to you. And the strategies are actually a bit different, and we've talked about this in a different webinar, but there are kind of different approaches to each of those situations that we talk to them about. And then finally, at the end, we talk about what next steps are, especially for the parents and coaches in the social coaching group. That's always a big one, to know what next, right? How to continue the practice, as well as what might be additional things their child needs help with. So we talk about that, and then we wrap up with a graduation party and ceremony to celebrate all the hard work our teens have put in over the weeks. And so the format that we follow for all of these lessons is we start out with a 30-minute homework review, where we talk about, completion as well as any problems that may have come up. It helps us individualize the treatment a little bit more when we go around and talk to each kid about their homework. Then there's the 30-minute didactic instructions, which is the lesson plan, the steps, the rules of the various different social etiquette, and that includes all of our role plays and modeling. And then the last 30 minutes is entirely spent on the teens actually rehearsing these skills with each other. So that's how we divide those 90 minutes up. So finally, I'm going to talk about the evidence base behind our programs, right? So to be called an evidence-based program or any kind of treatment program that's been called evidence-based, you have to establish a lot of different studies showing that this is an effective program over a waitlist group, or maybe compared to another type of social program that's being offered. And then those studies have to be replicated time and again, okay? So the first set of studies right here are, the ones that we took up at UCLA itself to establish the initial effectiveness of the program. And this was all mostly focused on teens and young adults with autism spectrum disorders. These studies have then, over the years, been replicated by multiple different partners that we have. So we have partners at Marquette University, especially, as well as internationally, that have replicated the effectiveness of these programs, including mostly within autism spectrum disorders, but including several other variables, right? Like the additional role of social anxiety in adolescents with autism spectrum disorders, or we have a Korean version of the PEERS program. So there's an evidence-based for teens on the spectrum in South Korea and the effectiveness of this program there. We also have a brain, like a neural paper using electroencephalography that has supported positive effects of the PEERS intervention in adolescents with autism spectrum disorders. Additionally, there's some evidence base for not only our school-based program, but also our parent-assisted program for teens with ADHD. So, this is considered, as I mentioned, a program that's not just for teens or young adults on the spectrum, but also past that we've had a lot of success with adolescents with ADHD, amongst other different clinical groups. And we have a program looking at the long-term treatment outcomes of our PEERS program. So I'll go into more detail with that one. So what have our findings shown so far? So if you look at these graphs right here, what we're looking at is mean change in score. So that means how much the scores based on parent report measures have improved from, this is comparing a treatment group and a waitlist group. So the violet sort of bar is the treatment group, and then the pink bar is the waitlist group. And so as you can see, the mean change in scores for our treatment groups in improvement of social skills, number of hosted get-togethers that our teens are reporting or their parents are reporting, as well as their social responsiveness has improved significantly for the treatment group using PEERS versus a waitlist group that is not doing any treatment. We also have a 14-week follow-up study for the parent-assisted program. So basically what we do is your T1, which is time 1, is before the treatment. T2 is right when treatment is ending, so like the last week of treatment. And T3 is 14 weeks after that. So about 4 months after they've ended the PEERS program. So what we see here in the first graph for social skill scale is that, from pre to post treatment, there's a significant increase in parent report of improvement in overall social skills in the treatment group, right? And those effects seem to kind of continue and hold pretty well 14 weeks post treatment. Social responsiveness, so this graph goes the other way. You actually want a lower score on that measure. Lower scores are better. So as you see, from time 1 to time 2, there's a drop in that score, which is good. So it means that social responsiveness has improved post-treatment, and that continues 14 weeks after treatment. And then finally, we see this is the teens themselves reporting hosted get-togethers. So there's an increase from pre to post-treatment, and then it kind of drops off 14 weeks after. It's still better than pre-treatment, but there is a drop. So we were very curious about this one because everything else was kind of holding pretty well 14 weeks post-treatment, except for this one adolescent report. And we started talking to our teens about what that was about. Were they not having get-togethers? And it turns out that actually a lot of them weren't reporting all the get-togethers that they were having. So at some point, the get-togethers started to become so regular that they kind of forget to keep track of it and were not reporting on all the get-togethers that they were having with their friends. Other promising findings from these follow-up studies is that you see a big drop in problem behaviors based on parent report, and that actually continues to drop even further at the follow-up point. And then we have a teacher report as well of improvement in social skills. So the teachers are also reporting, they're not always aware of what's happening in the groups and what the content of the treatment is, but they are also noticing improvements in social skills in the classrooms, pre and post treatment, and then they reported that that was kind of improving further 14 weeks following treatment. Other studies that we've had have focused more on the school-based curriculum for teens with autism spectrum disorders. So what we did here is we don't really have a waitlist group, but we compared it to another kind of prototypical social skills program that's used in schools over here. So again, we're looking at mean change in scores. So we actually see a big improvement in social responsiveness here overall compared to this other social skills group. And these are all teacher reports, by the way, for this study. So across the board, teachers are reporting improvements in social motivation, social communication, social awareness, as well as decreases in autistic mannerisms over those 16 weeks of the school-based curriculum compared to another treatment program. Teachers are also reporting increase in hosted get-togethers in the prior month from when we did this study. And then the number of invited get-togethers as well. So there's more hosted get-togethers than invited get-togethers, and you can't actually see very much what the bar looks like on that invited get-togethers, but it's there, and it's a significant difference between the two groups when you look at it statistically. They're also reporting decreases in social anxiety over those weeks and improvements in the adolescent's social skills knowledge itself. Another study that we did was looking at the additional contribution of parent assistance using the school-based program. So it's a teacher-facilitated program, but parent-assisted study for teens with ASD. It's a little bit confusing. So what we have is a group of people that have parent assistance and no parent assistance during this program, and we do a pre-test and post-test like we do for all of our studies before and after the treatment. So first, just looking at, again, this study showing a lot of improvements between pre-test to post-test scores. So some of these are a little bit confusing again. The graphs on the left-hand side, you actually want the scores to go down. So you're actually seeing that trend at post-test. And then in terms of overall social skills and hosted get-togethers, you want to see those numbers going up. So you do see that trend as well on the graphs on the right-hand side. As well as there's the teens themselves are reporting an increase in their overall self-esteem and knowledge of social skills pre and post-test. Now, comparing the two groups where there was the parent assistance and no parent assistance, we find that, they kind of start out at different points pre-test, right? And we think that this might be because, we're talking about school-based kinds of social skills. And so maybe the parents that are not assisting in the program are not maybe as tuned into where they were when they started out with, in terms of just their school social skills. But for the parents that are involved, you see a lot of change in scores in the positive direction across all these different domains, pre and post-test. As well as they're reporting improvements. The FQS that's reported here is a friendship quality sort of questionnaire. So the parents are noticing improved companionship between them and their friends, improved helpfulness from their friends, the friends towards their teen, as well as decreases in conflict between the teen and their friends pre and post this treatment program. And finally, I want to talk about one of our long-term follow-up studies. So this is a study that, we do the time 1 and time 2, that is pre and post-test, before and after treatment, but then there's a time 3 that is anywhere between 1 and 5 years following when they finish the peers program. This is the parent-assisted program. So we actually got a pretty good response rate from that program. These studies are really hard to follow up on, especially 5 years down the line, but our response rate was about 64%, so that's pretty good. We actually controlled in the study for differences between the participants and non-participants at baseline. So we want to kind of get a group that was somewhat similar at baseline and then see, what they look like with the group that actually participated in the program. Okay. And so here we see that, the parents are generally going from, in terms of reporting social skills and improved social skills, they're kind of going from like the decrease range to the average range, right? From pre to post treatment, but then that continues at this time 3, which is a few years following the treatment. Parents are also reporting decreases in problem behaviors, and that trend continued few years after the program, after program completion, as well as I mentioned, like their social responsiveness improved as well. So it went from the severe range before treatment to the mild to moderate range post-treatment, and then a few years after as well. In terms of total get-togethers that people were reporting, again, there's a significant difference between pre-treatment and post-treatment, especially in the teens report themselves. And then, how we said it drops off on the teens end because they're not reporting all of their get-togethers at some point, but still way better than what they started out with at time 1, both in terms of the teens reporting themselves as well as the parents reporting number of get-togethers that they had in the past month. So that's sort of our overview of all of our research studies. I've included all of those snapshots of the papers in our handouts, but I'm happy to share other resources with people who would like to get more details on those research studies. We have a lot of different research partners, as I've mentioned. So this is kind of a list of some of our more frequent collaborations over the years. And in terms of our future research, we have several different things we have lined up, but one of the big things we have gotten funding for is to make this whole dissemination project with more than 100 different role play videos that, will be like open source, and everyone can sort of access that and use that to work with their kids, their patients, their students, whoever is the group that they're working with. We also are interested in developing a peers for teens with intellectual disabilities, so more lower functioning individuals, as well as sort of these summer programs like a club peers or a camp peers that would be more like maintenance programs with some booster sessions, that maybe teens can do every few years or so to keep up their progress and their social skills. In the immediate future, we are going to be working in the next year on developing a peers just for dating skills. We have a huge amount of interest in this, as well as developing kind of online dating skills and things for individuals with autism spectrum disorders. So we are going to be developing a curriculum for that in the next year, as well as a peers for careers. So focusing on career and job relevant skills that our teens need to kind of keep up with the social environment there. Just a list, I want to acknowledge all of our different collaborators and lab members and support and funding. As you can see, it's a pretty elaborate list here. And then finally, I want to leave you with sort of our, how you can reach us. So we have some social media pages where you can follow us for updates, but there's also contact information on this slide, as well as our website. And on our website, you will find a lot of information about all of our programs, our research studies. I think it has the entire list of all of our publications that you can access there, as well as all of our role play videos that any parent, anyone who goes on our website can just access and watch. Right, and that's about it.
Okay, great. Well, we've got lots of questions. You just answered many of them because a lot of people were asking about resources. But one question, I know we've had this before when you've spoken, is just about age groups. So
right.
You went over that a little bit. One of the questions was about elementary school age kids and options for them.
So the elementary age group is the only age range that we don't have a program for at Peers, but that's because there is a sister program at UCLA called the Children's Friendship Program. So that's meant for elementary school age kids. I think it's targeting specifically second grade kids to sixth grade kids. And it's a lot of it is pretty similar to our curriculum, but there's less kind of teen conflict situations at that point, and a little bit more play skills still involved in that age group. So if you go to the UCLA Children's Friendship Program website, you will get more information about their program, as well as the kind of skills they focus on and their resources for that age group.
Okay, this person's asking about emotional regulation. So I think it's built into some of what you described, but are there specific modules that really work on sort of cognitive behavioral techniques, or specifically targeting emotional regulation for the patients?
Right. So we don't actually have any specific lessons based on that. When we do our intake process, we kind of screen for emotional regulation, right? And there's the whole spectrum. So if we find that it's kind of maybe mildly there, but not necessarily going to impact their participation in the program, then that's something that seems to kind of improve with practice and coaching and being in our program. But if it's something that's kind of really predominant for someone, then we actually suggest that they get CBT more one-on-one individually with the provider, kind of work on that first before they work on their social skills, because it is a bit challenging to be present and engage in a pretty demanding program like ours if there is kind of any kind of emotional difficulty that you're struggling with that's holding you back in a way. And that's not necessarily the case for everyone, but so we kind of have to assess what's the primary concern for each of our teens when they come in for the intake.
So this person is asking about ongoing treatment. So can they do peers back to back to back, or do they go through the program just once and they're done? What is the maintenance plan?
Right. So we actually don't encourage them to go back to back to back, because that's why we're coaching parents to learn the program, right? So the idea is that by the end of the 16 weeks, the teens, as well as especially the parents, have built a lot of competency in being able to continue coaching their teens through this program. So they are expected to continue all of that coaching once they're done with our program. Over the years, sometimes we get teens that will come back to our program though. So for example, someone may have done it when they were 11 or 12, and then now they're 16 and their demands have changed a little bit in their social life. And so they kind of feel like they need a refresher. So they come back and do the whole program again. Or more recently, what's been happening is we have teens that do the teen program, and then when they are young adults, they come back and do the young adult program, kind of get a refresher of all of those skills, and then learn the additional skills that we're teaching in the young adult program, like the dating skills.
Okay, I've gotten lots of questions about finding peers in other locations. Mm-hmm. Obviously, you're in Los Angeles. So people are trying to identify, mostly in big cities like Indianapolis, Minneapolis, Philadelphia. So how would they find local treatment?
Right. So this website that's right on the slide right here, the seminole.ucla.edu, if you go on our website, we have a tab on there that says Peers Certified Providers. So those are providers that came to UCLA, did a 3-day workshop, went through the whole training with Dr. Logerson, who's the director of our program, and received a Peers certification to be able to provide this treatment independently. So if you go under the Peers Certified tab, you will find a list of all of the Peers Certified providers divided by state, and then in some states, depending on popularity, also divided by city.
Okay, and conversely, people are asking about getting training. So how to get into the training program that you do there?
If you want, email the Peers Clinic on this email address that I've provided right here to find out about training requirements. But again, if you go on our website, you will get a list of all our upcoming training events. Most of them tend to take place at UCLA, but often we also do things at other locations based on, if you're invited to do that there, if there's a sizable group wanting to be trained there.
Okay. The next question, actually, people are asking about the handouts, so I just wanted to say this aloud. They're online at ariconference.com/webinars/peers_overview.pdf, and that's over in the chat. So if people are looking for that, I'll also include that link in the follow-up email that we'll send later today. So if you're not able to write that down or grab them right now, we should have that in the follow-up email, so you can look for that. People are also asking about the parenting module. So I know that they run concurrently. So maybe you can talk a little bit about what that looks like every week if they show up.
Right. So the parent groups that take place every week, that's a little less structured and much more of like a discussion group, right? So what we go around doing is we not only review homework with the teens, but we also review homework with parents because, they have a different perspective sometimes on it. So we talk about homework completion, if there are any problems or issues that are coming up. So each parent goes around the table and talks about that for their individual teen. And what we also talk about is like just the teen's progress from week to week, and if there is any resistance from week to week. So if there's any anxiety about trying out some homework or trying out some of these skills with their peers, or if there's resistance to the parent coaching them on some of these skills, that's something that we discuss week to week. It helps us actually in the parent group tailor the program a little bit more for each individual teen that's in there, So it's pretty much a big sort of discussion support group as well. We talk about progress, we talk about the actual skills, we talk about how to coach their teams on those skills, and then we also talk about just some of the logistics. So, helping them find those social groups, or if we feel like our teens need to be engaged in some kind of social activity to access peers, then what is feasible for that family? So we talk about all of those kind of factors, but it's a much more just discussion, free-flowing kind of based group, which also serves as kind of a parent support group.
So this person's asking about peers camps. If there's a parent component, are there also camps that are just for the teenagers?
So we don't actually have peers camps yet. That's part of our future research projects. So we haven't kind of yet developed what components would go into that, but we get asked that a lot. Like if there are things in the summer at peers that our teens could do, I feel like every summer we get asked that. So that's why we are trying to develop this program, but we haven't exactly decided what components and who will be participating and things will go into that. We'll have to do some focus groups and such before we get to that point.
Okay, this person's asking, do the teens enjoy it? Do they like coming, or is this a sort of drudgery for the participants?
Right. So I think that ties very much into the social motivation piece, right? Like, as I mentioned, it's really hard to get teens to do something that they don't want to do. And we kind of go with a do no harm policy, right? We don't want to force a teen into a program and force them to do homework assignments, and then that's going to create more parent-child conflict at home. So the teens themselves being socially motivated is a big part of us accepting them into the program. And sometimes the teens, like recently we saw a teen that was not ready a couple of years ago and is now very ready. So that happens too. Like with age, they are more and more willing to come in. But once they are in, there is some initial anxiety. I think the first couple of weeks, it's a new group, it's a lot of new people, new format, but they do seem to enjoy it. I think they especially enjoy the role plays and the rehearsals at the end, and a lot of our teens end up becoming friends with each other, keep in touch beyond the program.
So you talked a little bit about the screening process that occurs, and you talked about emotional regulation. What about expressive language deficits? So if somebody has some expressive language challenges, would they be a good candidate for the program?
Right. So again, it's a case-by-case thing. As long as they are able to follow along, with what we're saying. They seem to understand the material when I'm explaining it to them during our intake evaluations. We accept them. So, everyone in the group is generally pretty patient with, if someone needs more time to express themselves and things like that. So that's not usually a problem. But if it is challenging for the teen to keep up with, the content, and if they're going to get left behind in the class because they couldn't keep up and it's not an individualized program, then, in those situations, we suggest that they contact one of our other peer certified providers from the website, some of whom provide peers on an individual basis. So like one-to-one with the teen and or their family member.
This person is asking about what happens if you get into the program and it becomes apparent it's not working for your teen. Should you give up? Should you come back another session later? What generally happens if it appears it's not working out?
Right. So we rarely get a situation where we feel like someone who's in the program and is appropriate for the program is not benefiting. What happens is sometimes there might be a big medication change that impacts, as we said, like their emotional regulation or their mood. And that becomes an obstacle then in the program. So in those cases, again, we kind of assess, we talk to the family a lot, we'll try some different strategies from week to week, and we keep an ongoing kind of discussion with the parent going about, is this actually still beneficial to the teen or is it actually doing harm? So if we feel like it's doing harm, we would recommend that they kind of sit out for the rest of the sessions. And then, if they need another treatment component, like individual therapy for mood or emotional regulation, they do that first and come back for the program. But we usually don't find because we have a pretty tight screening process from having done this over the years. So we don't usually get people who are appropriate for the group feel like halfway through that it's not working out for them. It's usually like an external factor, like schedule change or like a mood, or for sometimes, our teens might get hospitalized for other psychiatric needs. And then this is not kind of their predominant area of concern right now. They need to work on other things before they sort of come back.
All right. This person's asking about graduate school and being part of the peers clinic. So who would they contact if they're interested in trying to be part of the program?
You can email the peers clinic, and the coordinators will guide you depending on whether it's like wanting to work in the research lab or wanting to know if they can be a graduate student at the UCLA peers program. It would be slightly different, but if they wanted more information on that, they could contact the peers clinic at ucla.edu, and our coordinators will guide them accordingly.
Okay, I think we've got time for one more question. This person is asking about peers in schools. So are there school districts that have adapted this program, or is this generally something that needs to happen outside of schools?
So the school-based curriculum that we have is implemented in schools. It's implemented during the school hours. We have it's not generally a whole school district-wide thing yet. But in LA especially, we have a bunch of different schools that have sent all of their teachers to get trained on it. So we have a specific training for educators learning the peers program versus mental health professionals. And so it just varies. So some schools will send like just the school psychologist, and then other schools will send all of their teachers. But so far we haven't had it be like a mandated school district wide thing where where everyone has to be trained or so, but it is implemented during the school hours.